All right, let's go ahead and get started. So, first question, could you please introduce yourself and your position in this organization?
Yeah. Hi, my name is Michelle. I am the current president for Vietnamese Community Health at UCLA.
Great, thank you. And so, what does your organization do?
Yeah, so we're a community health organization. We typically focus on the patient populations in Orange County and the greater Los Angeles area. Typically, we try to go for the Vietnamese and Spanish-speaking populations, underserved communities, so that we can uh, target our services for those populations.
Great, thank you. And so, next question is, what does being a member typically look like?
Yeah, so as a member, you have opportunities to volunteer at our health sites and health fairs every quarter. So our health sites are more of like on a regular basis. We go down to Orange County, we have really small free healthcare services that you directly do for our patients. So that includes hand dynamometer screenings, vision screenings, and more. While health fairs are more on a quarterly basis where we invite out a lot of uh, professional health students and healthcare providers to provide a lot of services like dental screenings, vision screenings, hemoglobin screenings, and a lot more. So you get to talk with those providers and help them carry out the screenings.
Great, thank you. And so, next question is, what makes your organization different from other pre-health organizations on campus?
Yeah, one thing that our organization prioritizes is making everything accessible to our members so that we actually don't have any application or fees to join. You are anyone who wants to join can join. You don't have to be Vietnamese, even though that's in our name. So we try to make everything accessible so that they can get the experience they need because we recognize that it's hard to get pre-health experience on campus. So we want to make everything as accessible as possible. And additionally, we also focus on cultural responsiveness. So we try to emphasize that while working at our health sites and health fairs, we have our volunteers serve as translators as well for our screening so that we can help our patients because we know that our patients are uh, face language barriers as well, so that we try to reduce the cultural barriers as much as possible.
Sweet, thank you. I know you kind of answered this a little bit in the last question, but is there an application for your organization? And if so, when are applications due? And what does the application process look like?
Yeah, so we actually don't have any applications or fees, so no deadlines, anything you have to worry about. Just show up to any of our general meetings, and you can get started from there. And yeah, there's no application process at all.
Got it. And since there is no application, I guess I'll switch up the next question a little bit. So I guess what qualities distinguish members as strong members for your organization?
Mhm. Yeah, so we actually have our members, they can also be active members as well. So active members are mainly just those who fulfill our active member requirements in which they show up to one site, one health fair, and half the general meeting. So those are the requirements for active memberships. I guess in terms of strong members, there's just members who are dedicated to serving the community, who show a lot of interest in our GMs and active participation.
Great, thank you. And what is one impactful personal experience you've had within this organization?
Yeah, so when I actually joined this organization 3 years ago when I was a freshman, I got the opportunity to serve at the Vision station at our health fair. And at this station, I remember the optometry student giving me the stick to point at the 2020 sign that everyone knows and loves. And I was directly like pointing at letters, and then she told me to move down and all for patients. And I remember this experience so vividly, and it was really impactful in my experience because now I'm a pre-op student and I'm planning to go to optometry too. So it made a really good impact on my personal career choice, and I am very grateful for it.
Sounds amazing. All right. And that wraps up our general questions. So we're moving into our cultural affiliation question. So how does your organization promote awareness and appreciation for your community?
Yeah, so knowing our patient demographic, which is mainly like Vietnamese and Spanish speaking, we try to tailor all of our events to serve them in the best way possible. So one way, like I mentioned earlier, it's we have translators that speak Vietnamese and or Spanish so that um, we can help better serve our patients. And in terms of food that we offer as well, we try to make sure that it's food that our patients recognize and are good with. So we typically have banh mi, which is like Vietnamese sandwiches, and that's something our patients really truly appreciate having because it's a healthy food for one, and also it's just a food that they recognize and are comfortable with eating. And as well as appreciation for our community, we tie it to give back where we can. So in COVID, we try to, in COVID, recognizing that there's a lot of public health issues and safety issues in mind for our patients, providers, and volunteers, we decided to, instead of a health fair and health sites, we tried to have a patient care package drive. So we raised a lot of money, we got a lot of funding to give back to the community with free care packages that included PPE, snacks, mass, and more.
Great, sounds amazing. And to wrap it up, our last question is there anything else that you wanted to share about your organization that you didn't get a chance to?
Um, I don't think there's anything else that didn't get mentioned to.
Sounds good. All right, sweet. Thank you, VCH, and thank you, Michelle, for coming on today. We really appreciate it.
Yeah, thank you for having me.
Of course.